bring on our friend Dr. Arif Dalvi. He is a neurologist and director, Palm Beach Neuroscience Institute, Delray Medical Center, and of course, both part of the Palm Beach Health Network Physicians Group. And Dr. Dalvi joins us. And Doc, appreciate it so much. And, I guess for starters, before we get into the specifics of Parkinson's disease, how much is that a focus of, your everyday work?
Well, first of all, thank you for having me on. It's really a pleasure to be with you and your listeners. In terms of my work, right now I am the director of the Parkinson's program and the Comprehensive Movement Disorders program, as well as the Memory Disorders program. So I focus pretty much my entire day on seeing patients with Parkinson's and similar conditions like tremor, as well as patients who have things like Alzheimer's disease and other dementias. So it's really the bulk of my practice is devoted to what we call neurodegenerative diseases that affect the brain as we grow older.
So what are the main symptoms of Parkinson's disease?
So the four main symptoms are tremor, and typically this is tremor when the hands are at rest. You can also get muscle stiffness, slow movement, and difficulty walking. These are the four hallmark symptoms, but you can get subtle symptoms like just a little shuffling when you walk, or soft speech, or you might get something like a change in facial expression. So there are a number of other subtle clues that are part of early Parkinson's.
We were talking about Kirk Gibson, and he announced it when he was 58 that he had Parkinson's disease. So what do you look at in terms of specific age ranges? Is there a specific age range? Are there age ranges that are more susceptible to Parkinson's?
The most common age range is 55 to 65 years, but I personally have a fairly large number of patients who are in their 40s and have Parkinson's disease. And the youngest I've diagnosed was 19 when I diagnosed her with Parkinson's disease. So while the bulk of Parkinson's is considered to be a disease that affects older or even elderly individuals, we have a number of what we call as young onset Parkinson's patients. Michael J. Fox would be a classic example of somebody who started really young.
Yeah, no, absolutely. And when you have, younger patients that you treat, are there things, that make them more susceptible to possibly getting not just Parkinson's, but getting it at a younger age?
Right. So there are certain genetic risk factors. So for example, in my 19-year-old, she had a specific genetic mutation in what is called as the Parkin gene. And this gene is responsible for maintaining your ability to handle oxidative stress in the brain. That's one of its functions. And when you're unable to handle oxidative stress in the brain, the oxygen radicals that are produced as part of normal metabolism, they kill the cells that make the dopamine. And that's what is the chemical imbalance that's created that leads to Parkinson's. So there are certain genetic predispositions. Certainly, the other area that we've seen in terms of environmental risk factors are repeated head injuries. So certainly people who play sports like boxing or football, even though the helmet protects you against your skull being cracked, the brain inside is sloshing around in CSF and can lead to long-term issues with these kind of conditions.
So if someone has Parkinson's, can you go through, what the medical treatment and options are? Obviously, there's medications, but if medications aren't working well, or if they're not the answer, then what else are the other options?
So the mainstay of treatment is called levodopa or L-DOPA, because this crosses the blood-brain barrier and gets converted into dopamine, replacing that dopamine deficit that I mentioned is the main chemical imbalance behind Parkinson's. Most patients respond quite nicely in terms of all their main symptoms, but as the years go by, say at the 5-year mark or 7-year mark, they find that the medications are less and less predictable. So they start to wear off before the next dose is due, or they may not kick in at all, and all of the symptoms come back. So for these patients, we offer surgical options. So at Delray Medical Center, we have been offering deep brain stimulation surgery for the last 6 to 7 years. We have a major program. We perform a lot of DBS surgeries. But more recently, we are developing a newer technique called focused ultrasound, which is really interesting because it allows us to offer brain surgery without even going to the operating room. So that's the novelty about the procedure.
Boy, this is fascinating. So brain surgery without going to the operating room. Can you elaborate a little bit more on that?
So, when we were kids, we play with this magnifying glass and we focus the sun's rays onto a little spot on a leaf, and then it starts to burn. Same idea. We use ultrasound rays, same thing that is used to look for a baby, except these are focused onto a tiny spot in the brain, just like the magnifying glass focuses the sun's rays. And this beam of energy then is able to zap the cells, the brain cells, the neurons that create tremor, that create slowness, rigidity, muscle stiffness. And the beauty of it is, unlike DBS, which is also very effective, but it involves drilling a burr hole, putting a wire into that area of the brain, putting a pacemaker underneath your collarbone. This surgery is done in an MRI suite. So we don't take you to the operating room. We take you inside an MRI scanner. You're awake during the procedure. We are testing you for your tremor. And you have a response the same day. So there's no adjustment of the DBS device or anything of that sort. You go home the same day. There's no hospitalization. So it's really a major development in terms of managing patients with Parkinson's, but also with tremor disorders. And in fact, we're expanding this technology with Insight Tech, which is the company that makes this technology. Governor DeSantis actually has funded a program looking at innovative techniques to address the issue of Alzheimer's disease. So we're expanding a different type of ultrasound technology called low-frequency ultrasound to research in that area as well. So very promising technology, even though new, a large part of it as far as tremor and Parkinson's goes has been proven already.
Wow, just amazing. Every single day, what you guys, Palm Beach Health Network physician groups, are able to do in terms of just advanced technology.
Indeed. I mean, it's really takes a very collaborative effort. I have to commend the work of Dr. Lloyd Zucker, who's our chief of neurosurgery. So Dr. Zucker and I have been working for the last 8 years in bringing all of the new developments with DBS, like some of the newer electrode techniques. They're called directional electrodes, some of the newer pacemaker devices that actually allow us to sense the activity in the brain as a way of adjusting the DBS devices. And this is our latest team effort, which is focused ultrasound.
Dr. Dalvi, are there things that we can do that, I don't know if it's preventing Parkinson's or helping if we might be susceptible, but are there things that, might make one less at risk for it?
I think the two main things are diet and exercise. Physical exercise in all of these neurodegenerative conditions has been shown to have a major preventive aspect. So physical exercise, and especially aerobic physical exercise, the kind that makes you a little short of breath, that makes your heart rate go up, that is really important. And as well as diet. A Mediterranean diet, or more specifically, a modification of it is called the MIND diet, Mediterranean/DASH diet. That again has been shown to have major preventive benefits in terms of these conditions.
Well, Dr. Dalvi, we can't thank you enough. And, for anybody that, is listening, interested in finding more about you, potentially setting up an appointment, especially all the cutting edge technology like the focused ultrasound, how can people best get in touch with you?
The best way is through our website at the Palm Beach Neuroscience Institute. It's pbni.com. I think that's the best way to reach us. And thank you, Jeremy, for having me on.
Dr. Dalvi, always a pleasure, and best of luck with everything going on.
Thank you.